Caribbean nationals depending on organizations for HIV support could lose the assistance, as some organizations may be forced to close their doors due to a lack of funding. International organizations operating within the Caribbean region are concerned that the gains made in the last quarter of a century in the fight against HIV could be rolled back. In a joint statement on Tuesday, the United Nations Programme on HIV, UNAIDS, and the Pan Caribbean Partnership Against HIV and AIDS, PANCAP, said Caribbean HIV service organizations are experiencing severe service disruptions and financial instability that threaten to reverse decades of progress in the HIV response due to funding pause by the U.S. government in January of 2025. The organization said a rapid assessment conducted by several agencies in the Caribbean between March 27 and April 2022 of this year found that there are critical disruptions to HIV services. HIV prevention and testing services critical for maintaining the region's progress towards ending AIDS have faced universal disruptions. Further, organizations responsible for capacity building are severely impacted, with 80% of them reporting suspensions or significant reduction in services. 75% of social protection services have been disrupted, while human rights programming, a cornerstone of the Caribbean HIV response, has been affected in 67% of cases. Dr. Richard Menya, director of UNAIDS Multi-Country Office for the Caribbean, was quoted as saying, "We cannot allow the progress we have made in the Caribbean to be reversed." The findings paint a stark picture of a fragile funding ecosystem that has left our most vulnerable communities without critical support. He added that the organizations are not just service providers. They are the backbone of the HIV response, reaching populations that formal health systems often cannot access. The survey also found that only 25% of organizations can sustain services for 2 to 6 months without alternative funding, while 64% are uncertain about their ability to continue operations. Already, organizations have reported increased health risks, reduced access to care, and heightened mental health challenges, including depression and isolation, among some of the region's most vulnerable citizens. Both UNAIDS and PANCAP have called for immediate action to be taken to address the funding crisis so as to ensure the continuity of life-saving HIV service across the region.